Hey everyone, and welcome to this last episode of season 4 of Hormonally Speaking. Today we are doing something a little different I've been wanting to do for a while, and that is a Q&A on the podcast, because there are so many questions that I get all the time and that my colleagues get all the time, that, we can't always answer everything because some of them are very specific medical issues for that person, but just some generalized things. I think so many of us out there are confused about all the information coming at us. And then, of course, we're all individuals and have individual reactions to the different things that we try. So here we are today, and I am with my colleague, Marieke, who you've seen before on the podcast. And hi, welcome. And I'm super excited for us to go through these Q&As. Marieke and I work together with different clients and on different projects, and we just thought this would be a fun opportunity to do some chatting. So come along with us for the ride. So welcome.
Thank you.
Yeah.
Glad to be here.
Yeah. So mostly we're talking sort of perimenopausal issues, BHRT, which is bioidentical hormone replacement therapy. If you've been listening to the podcast at all, you know that that is something that I like to talk about a lot. And there are a lot of questions around that. So we got, I don't know how many, like 40 some odd questions or something, like 30 some odd questions. So we're definitely not going to be able to get into all of those today. But we're going to start off with some of the big ones that kind of jumped out to us, and then hopefully do some more of the questions, answer some more of the questions in later episodes. So you ready to dive in, Marieke?
Yeah.
Yeah.
Let's do this.
Okay. So the first question that we got is a sort of all-encompassing kind of question. So we can't go 2 hours long on the answer. So we're going to give you some basics. And that was, any specific ways to support my body and mind while heading into perimenopause? And that is from Jody. Do you want to start with some thoughts?
Yeah, I think the biggest one that comes to my mind is really stress management. So for me, stress is the biggest hormone killer ever.
Yep.
And it just doesn't get any better once we hit perimenopause. And that's also linked to the lack of progesterone. So our progesterone is naturally declining as the first hormone, as probably many of the listeners actually know. But that actually gives room for cortisol, which is our stress hormone, to rise. And so that's why we actually are exposed to, or we're more prone to be stressed in perimenopause. And anxiety is just one thing that happens for many women that comes with it, also with the low progesterone. But basically, when we have elevated cortisol, it affects so many other things, and it affects our blood sugar. It affects, and it all kind of comes together and circulates back, so that in the end, we just, the more stress we have, the higher our blood sugar will be, and the less progesterone we will make, and the more anxiety we will have. And so, I mean, it's all this together, basically. And I think that's probably the best thing that you can do for yourself and for your hormone balance is to manage stress. And of course, I mean, this is like a big thing that I think we have this conversation a lot with our clients who are just, busy moms with kids and careers and basically all these things going on. And so I think the first thing is actually that I always recommend is to kind of take an inventory and really see, just get aware of what kind of stress you have in your life. And for me, actually, exercise was a big one. And it took me a long time to actually notice or realize that actually maybe exercise if it's too much, it can also be a stressor. And so it can be so many different and just silly things that we don't even think are stressing us. But basically everything that impacts your mind, that makes you worry, and it can sometimes also be stressful relationships, even with people that you like. but they're just sucking out your energy.
Yeah. Yep.
And
It's a big one.
so, I mean, I have a friend like this. I like her a lot, but when I spend time with her, I feel like I need to recover for a couple of days afterwards.
Yep.
And so, I mean, she's still my friend, but I just make sure that I don't see her that much.
Right. You're like, I love her from afar more often.
Yeah, it's kind of like that.
Yeah.
Or I set boundaries. You know,
Yeah.
I say,
Yeah.
okay, let's meet. Yeah, let's meet and have a coffee. So I know it can't just kind of develop into this meeting where, you know, I will never be able to get away.
Right. Like hours
Or
long. Yep. Yep.
yeah,
Mm-hmm.
or you know, she will be at my house and I will be like, okay,
Yeah.
scanning along. So
Yeah.
I mean, this may not be applicable to everyone, but probably everyone has, you know, some sort of area that they
Yeah.
can look into
Yeah.
and basically take an inventory and kind of look at what can you scrap from that list.
Yeah.
And the
Yep.
more you can scrap from that list, the better.
Yep.
Where can you get help? You know, sometimes we're
Yep.
just stressing ourselves for nothing. We're just worrying about too many things and doing it all on our own.
Yeah.
But we have family, we have friends, we have all these people around us, and sometimes it's also good to ask for help, right?
Mm-hmm. Absolutely.
And
Yeah.
then, of course, if we have all these stressors and there's nothing we can do about them, what's really important is stress management techniques, and that's again very personal, I find. You know, getting access to some sort of meditation, and if you're not into that, trying like a yoga nidra or like a
Mm-hmm.
guided meditation, and you don't have to like go about it for hours every day. Or it's basically, I think it's better to do 5 minutes every day than an hour once per month.
Right. 100%.
And that can be just going for a walk, you know, basically taking at least 15 minutes to go into nature and take some deep breaths and just, you know, be there in the present moment. Those are all things that can really help to kind of wind us down and bring us back into this parasympathetic state.
Yeah. Yeah.
And that can be a big help,
Yep.
I think. So
I think of it like the anti-hustle culture, right? We got so much into this idea of the hustle, you know, hustling multiple jobs, like handling all these things. And that is not how women's bodies work, right? We do not handle, particularly as we're going into perimenopause, we do not handle having a million things going on well. And we shouldn't, right? There's a lot of receiving that we need to start to get into the mindset of. I know I have to work on this always myself because we're so used to just that giving, you know. And I just actually posted an article on my website. It'll be a couple weeks, I guess, by the time this comes out, but it's about oxytocin and how, you know, what an interesting relationship oxytocin has with cortisol too, right? It's the antithesis to cortisol. And so what is oxytocin? A lot of people think, oh, when I have sex or if I'm breastfeeding a baby, but there's all of these other ways to get your oxytocin going. And really, like, when I think about that, I think about, well, what is fun? What is fun in my life? How can I bring fun into my everyday? Because that is actually what triggers oxytocin, right? And of course, you know, fun in what I say a healthy way, because I think as adults, sometimes we can go into fun as in a, you know, I'm going to go drink a bunch of drinks or
go overboard kind of way.
right, which is not so helpful when we're in perimenopause. So a lot of times I'm like, well, what did I really enjoy as a kid? You know, what did I really love doing? And trying to bring those things into my daily life as much as possible. Like, and this is, you know, not a 5-minute thing, but the other weekend I went to a water park with some friends because I loved water parks as a kid. And I was so
fun.
giddy to go do that, you know? And so I think you have to be more like concentrating more on what brings you joy to combat like what you were talking about, that decrease in progesterone that we know starts happening at age 35, right? So by the time you're early to mid 40s, you know, you may still have a normal cycle, but I guarantee that progesterone or lack thereof is impacting your moods. It's impacting that anxiety. It's impacting sleep for a lot of women, right?
Yeah,
Those
sleep. I was just
anxiety and
gonna say.
sleep. Those are the two big
Yeah.
ones, right? Those are the first ones that I see with my clients. And, you know, for a little while, things like Vitex, which is what a lot of people will take in order to support their progesterone, that can help for a while. But I'll be honest, like the deeper you get into your 40s, the less that that's going to work, right? You just
Yeah.
can't force your body to produce progesterone when you're not ovulating every month, when your ovulation isn't, you know, as quality every month. So while people can try that, and I think that's always a great thing to try and can work for a while, pay attention. And if it isn't working anymore, then I'm personally a big fan of thinking about progesterone, bioidentical progesterone,
Yeah.
way before a lot of doctors are thinking about it, right? I know that you're on it, and I know that
Yeah.
I'm on it, you know, and it's just, it's key on so many levels, right? And just to help level out stress, but also, you know, we're setting ourselves up for the rest of our lives, and getting hormones in before they nosedive is going to help, particularly your bone health in the long term, because while estrogen's the big player with bone health, progesterone is also part of that too. Your heart health and your brain health, you know. And so I I love that what I'm seeing lately is a lot more experts in the field, particularly in the bioidentical hormone replacement therapy field, who have been doing this for 30, 40 years. So they know their stuff. They're all recommending start it earlier than you would think you would, you know, don't wait
Yeah,
till
exactly. Yeah.
menopause, you know, don't even wait till late perimenopause, you know, start thinking about that now. Because
Yeah,
I,
and that's also the thing. Why would you actually wait so long until you can't like manage your life anymore, until you have
right,
like all these symptoms and you feel so horrible,
right, right.
and then you're already in it, right?
Yep.
So
Yep.
I mean,
And
prevention is always better.
100%. And I love herbs, and herbs can be helpful in a lot of ways, but herbs can't replace hormones that you're no longer making. Like they're
Yeah,
just
exactly. When your
no way.
ovaries will stop producing those hormones, as much as that sucks, and
Yeah.
we might not like it,
Yeah.
that's the way it is. So
Yeah.
if the ovaries stop producing the hormones, I mean, that's you can't stimulate anything
Yeah.
anymore.
Yeah.
So yeah, at one point there's not much anything else that you can do except taking bioidenticals.
Yeah, absolutely. And I do recommend people don't go willy-nilly on utilizing bioidenticals. You know, I mean, I know that most of them you can get over the counter now. You can get progesterone, you can get estrogen or estradiol, estriol. You can't get testosterone, but it is a really good idea to test your hormones, you know, just so that you have, I was interviewing someone recently where they recommended really starting to test your hormones mid to late 30s, so that you have a nice baseline of where, you know, things are before you start to nosedive. But even if you're in your mid 40s now, like it's a good idea to go ahead and test those hormones so that you kind of understand where things are at, because you could be
But that
45.
was actually the next question
Oh, it
from
is. Oh,
another.
okay.
Yeah, let's maybe
Slide into that.
well, first finish. I don't know, was there
Okay.
anything else we wanted
With
to add to Jody's
perimenopause.
question?
You know, I think, I mean, what you said is just so key around the stress factor, you know,
Mm,
certainly diet, in
yeah,
blood
exactly.
sugar balance, you know, becomes your as your hormones fluctuate, you're not able to handle sugar in the same way, right? Your insulin, the way your insulin reacts changes, all of these things. And so you need to really hone in on a really solid, good protein, you know, good fats, lots of veggies kind of diet.
Yeah.
And you know, I know that's tough for some people, but you are really setting yourself up for years to come right now. And then you're also just trying to support your body really well with keeping it on this kind of stable path
Yeah.
as your hormones are starting to go crazy, right?
And my clients say that all the time. When I eat well, I feel so much better, and I don't have all these symptoms.
Right.
But then if they
Exactly.
don't anymore, they immediately go
Slide
back
back.
to,
Yep.
yeah.
Yep.
And so it does have a huge
Huge
impact.
impact.
And
Yeah.
I don't know if I told you about the continuous glucose monitor experiment I did on myself.
No, tell us.
So that's a while ago now, but I basically I started on day 7 of my cycle. So they're always good for 2 weeks. So I was okay, I have this thing for 2 weeks, so I'm going to start in follicular phase, and I'm going to test, basically the second week of the follicular phase and the first week of the luteal phase. And so there were some interesting things in there, but basically the main takeaway from me was, I mean, I had basically the same meal in follicular phase, and my post meal reading was, I think it was 118, which is not like great, but
not horrible.
I mean, it's pretty normal. And it's pretty okay. And then when I was in luteal phase and had the same meal, I was at 128.
Interesting. Wow. That's
so
a huge
I had
difference.
10 points more just from, and that really started on day 19 of my cycle. So,
and that's why I know if you follow like, what's her name? She does the flow stuff. I'm blanking on her name right now, but she like following your cycle and food and the different parts of your cycle. Her big thing, Elisa Vitti. Sorry. Finally came to my head.
I don't know her, but it's like the seed cycling.
Well, she's more, focused on beyond seed cycling, like getting denser foods in your luteal phase. So the heavier, the red meats and things like that.
Yeah, I recommend that too.
Yeah. And I mean, that's kind of, you just showcased really well why that is true, right? Because just naturally your blood sugar regulation is not as good because of those hormonal changes that happen in the second half of your cycle. And so it is worth looking into, okay, what kinds of foods are good for me at different points in our cycle. And I think CGMs are a great way, right? Like you said, you can do a 2-week trial with a lot of these, and
and maybe really something also to keep in mind, I think, is that most women with PMS and everything, they crave so much, they really crave carbs and kind of nasty foods that you shouldn't eat in luteal phase.
Right.
And basically the better you eat already in the first phase of your cycle, less cravings you will have in the luteal phase. And then as well, that's really the time where you should really like keep away from, indulging into ice cream or, any of those snacks or drinking too much. Or basically, I mean, there's tips and tricks as well that you can probably apply, to help with also like having a fun night out without feeling too much.
Right. Absolutely.
Too much of those effects after that. But basically, I always say, like, if you start your cycle well, then you will probably have less of those cravings.
Yes.
When you actually arrive in that luteal phase. But if you do, really try to make the effort not to give in to those things, because you will just, it will just make you feel more crappy, and it will impact also, the way you will have your period and
and the 2 days beforehand, the PMS, right?
So,
the prostaglandins that are produced that make things not so great. Do you have any recommendations that you like in terms of helping people when they do have cravings? Do you have any supplements or anything that you like?
I actually have a blood sugar cheat sheet. But I like berberine.
I was gonna ask berberine. So I have to tell you, I just read that some people are calling berberine nature's Ozempic. I don't know if you have the Ozempic craze going on over there, if you've heard of Ozempic. Have you heard
No, I mean, I've heard it's as good as what's that blood sugar drug again?
Metformin.
Metformin.
Yeah.
It's been compared to that as well. So
I think people lose more weight, it sounds like, on Ozempic than metformin. And that's what people are using it as a weight loss drug, pretty much, even though it's supposed to be for type 2 diabetics. I think it can be used for type 1 too, but I just read that about berberine. I was like, oh, that's interesting, and I mean, obviously I think berberine is a great place to start if you're interested in dealing with, your blood sugar issues, along with a good diet for sure.
And chromium is also great for, especially if you have these sweet cravings.
Yeah. Yep. Absolutely. Absolutely.
Yeah.
I know some people really, I never know how to say it, but it's like gynema,
Yeah. Yeah, I know.
it's an
Janema?
herb.
Isn't it
Yeah, there you go.
Janema?
It's probably
Yeah, I
Janema.
also
It's
don't know how to
probably, yeah.
pronounce it, but
It's an
yes.
Ayurvedic herb, I believe, that you can get a form that you basically just let it just, melt in your mouth kind of a deal. And
Yeah,
then that's
there's
supposed to
chewy options or something like that, or drops, I think, that will
yeah,
also help with cravings. Yeah.
will cut your cravings down. So I know sometimes people are like, I need help, like help me with not, going into the cravings. So there's a couple of options, but okay, so let's go on to what kind of hormone testing is best to get the overall picture. And that was from Tripty. That's a cool name.
Yeah.
Okay,
Yeah,
so
you already got started on it,
okay,
right? So
yeah.
I kind of cut you off, sorry.
That's all right. No, that's fine. So I basically was saying, hormone testing I highly recommend because otherwise you're just guessing, because you can have the same symptoms with high estrogen and low estrogen, and same thing even with progesterone. So you really actually want to see where you're at. And there's a lot of experts out there that don't believe in continuing to test as you get deeper into perimenopause. But I don't agree, because I think it can be really helpful to see, particularly when your estrogen is going to start lowering. And yes, certainly estrogen can be high one month and low the next month when you're,
Yeah.
deep in perimenopause, for sure. But at least
But
to
it
get
always gives you an idea of what's really
exactly
going
right.
on, right?
And it's
I
like,
mean,
let's
it's
combine it with the symptoms so that we can really see, what's going on here. And then you can also know, okay, now is maybe a good time for me to start to bring estrogen replacement into, which, as we mentioned earlier, is a good idea to not wait until your estrogen has plummeted when you are in that last year before you technically hit menopause, so it can help with some of the craziness, like if you get that nice even estrogen coming in alongside progesterone. But anyway, back to the actual question. So there are lots of different options around hormone testing, and I will just say that I think that there's a lot of pros and cons with each, and it depends on which expert you listen to. A lot of them have different desires and what they want to see in tests, and beliefs around what the test is showing them. So let's talk about the main options. So blood or serum testing is kind of the most common, right? And I would say the big pro with that, particularly if you are working with doctors that are doing bioidentical hormone replacement therapy, the telehealth situation, I know a lot of them rely on blood testing because that has the most research behind it, right? The majority of the literature that's out there that they can point to and say this works, this doesn't work.
It's the most accessible as well.
The most accessible, it's
Yeah.
the cheapest to get,
Yeah, that's what I
usually
meant, yeah.
insurance covers it. For the most of us don't have an issue with the blood draw, some people do, but and you get it very fast, right? Like you take it and you probably get your results in 2 days. So that's really great. But the thing with blood, and I think a lot of people don't realize this, is that it is showing us total hormones, with the exception of like free testosterone. And you need it with your thyroid, like that's the way to go with thyroid. DHEAS is also the bioavailable, but the rest of them are the total hormones. And what that means is, basically if you look at 100% of the hormone in your body, 2 to 3% of that particular hormone, let's say estrogen or estradiol in this case, 2 to 3% of it is bioavailable, which means at any given time, it's what can get into the cells, do the little lock and key situation, and actually be utilized and by your body, versus 97%, 95 to 97% is bound. It cannot be used at any given time, right? It has to be converted.
And that's what's in your blood.
That's what's in your blood. Exactly.
Yeah.
So when you're seeing those tests, that's showing you your total hormones, which gives us some information for sure. But sometimes you can have total estradiol that looks great, for example, or total progesterone that looks great, but your free or bioavailable estradiol or progesterone isn't that great, you know? So
Well, with blood, you can also not, I mean, you have the 3 estrogens, right? And
right.
with blood, you can only get estrogen.
Yeah. Yeah. No, you can do the 3 in blood here.
Oh, okay.
Yeah.
I didn't know.
Yeah.
Oh.
But I believe that estrone doesn't show up well in blood. But no, excuse me, estriol doesn't show up well in blood, but you can the estrone and estradiol you can do. A lot of times though, this is another problem, is that doctors will run just estrogen. So that's like your total estrogens. That's
Yeah.
not helpful either. It's just
No.
it's not a helpful situation. And so that is why we don't necessarily particularly when we want to really see what's going on, start with blood, you know. um and I will say, just if you are on HRT, any form of HRT, the timing of you taking it will impact what shows up on the blood labs, right? So
Yeah.
if you're taking estrogen, that, you know, cycles through your body. I can't remember how many hours it is, but a lot of times you're missing that if you're taking a blood test in the morning, right? So you may be on the low end. So it's not necessarily showing you a good picture of how much your hormone levels really are if you're on HRT of any form. So
Yeah.
that's kind of the pros and cons with blood. You want to talk about saliva or dried urine?
Yeah, and I think we also had you had a copy, right, of the Dutch test.
Yes.
Yeah.
I can pull that up.
So maybe let's talk about that one,
Sure.
because I think we both like the Dutch test for different reasons. And that's basically a test that's very widely used. So what's really nice, and this is a dried urine based test. So it gives yes, we just seen it also gives an the cortisol readings, so cortisol being the stress hormone. And then this is the part that I guess we really like the most, is it gives a really nice, so it shows you your 3 estrogens. And I mean, in this example, they're all basically elevated. But it could be that your estrone is like within range, but your estradiol is actually on the low end, or your estriol is on the low end. I mean, this can be like, they don't always align like this. And this test gives a really good detail overview of, you know, how your different estrogens, how your different estrogen levels are, but also how you're metabolizing your estrogen. And that's something that's really important, I find, in perimenopause, when we are often basically in the situation, or we can't avoid to not being in a situation of excess estrogen, often because we have our progesterone is too low, and that makes us really prone to you know, fibroids, fibrocystic breasts, and just in general this kind of cancer risk. And actually in this test we can see how we're metabolizing estrogen. And what we don't want is that red pathway, which is the cancerogenic one. So we don't want our body to use that too much. And then we can also basically get an idea on how the methylation activity is. So in this example, we can actually see it's low, which, and although we see here the hormone levels are pretty high, but we're not actually detoxing them very well. So, and that may be genetic mutations or variants that come into play there, but it gives a lot of information on things that we can do to support hormone balance. So it's much more detailed. And then yeah, I think there was another question about testosterone later that we can look at.
Come back, yeah.
Yeah.
Just to show a little bit too about what you're talking about, the cortisol, you know, one of the best things I think about the Dutch is that, like, if you go take a blood sample of cortisol, and even saliva sample of cortisol, you're just going to get your free cortisol. With blood, they often only do one sample too in the morning. That's not telling us much at all, right? This test
No,
is
that's when
telling
it's
us,
supposed to be high anyways.
right.
So
And
if
so
it's low, you know something's wrong.
right. If if it's low, then okay, something's off. But what does it look like the rest of the day? And as you can see on here, this is giving us what we call a 4-point cortisol test. So your waking, your morning, your afternoon, your night, and you have these two black lines. And you want that red line actually in between those two black lines, about
Yeah.
halfway, right? And you can see this patient is like bottomed out, essentially at that
Yeah.
lower end of that black line. So they're definitely tired. They're definitely running on some low cortisol. But this
Yeah,
is,
they need a lot of coffee in the morning for sure.
for sure. So this is giving us your cortisol and your cortisone pattern, so we can sort of make sure that what we're seeing with cortisol is true. I mean, you can see both cortisone and cortisol are low, but this person is really, their body's really like pushing out that cortisol, trying to make it higher, and it's just metabolizing it out of the body real fast, because it's just like there's a
Mm.
inflammation stress situation going on, right? You can
Yeah.
see with the metabolized cortisol is high, and the more cortisol metabolites. So all that's to say is that it's giving us a much better overview, in my opinion, than any other test when it comes to your stress system, your adrenals, your cortisol output, which is really helpful. As you mentioned earlier, stress is the biggest issue when we're going into perimenopause. What we need to focus on.
Yeah, and I do think that also it's very important to, when we potentially want to put somebody on bioidentical hormones, before starting estrogen, we want to make sure that we're also metabolizing our estrogen well.
Yes.
Because if we start, even if it's bioidentical hormones, and we start somebody on bioidentical estrogen, and that person is not metabolizing her estrogens well, then we will actually not create a good situation. So,
right. And
yeah.
I think that's really important to think about, particularly if you have fibroids. This is something that I'm well aware of with, my fibroid history, that I know there will be a time when I need to go on estrogen, and yet estrogen, essentially, especially if we're not metabolizing it well, feeds the fibroids. And so I will certainly be tracking my estrogen metabolism at that point, when I bring estrogen into the mix, and making sure that I'm utilizing things to continually support good metabolism of the estrogen. So, and I know that's a huge debate. I've seen it a lot. Some people say, oh, taking supports to help your estrogen metabolism when you're on BHRT for estrogen is not a good idea, because you're going to lower your estrogen too much. Here's the deal. Some people, it doesn't lower it that much. Things like DIM, calcium D-glucarate, those kinds of things. It may not actually lower your overall estrogen that much. It's just helping to metabolize the hormones. But even if it does, some people need to find this sort of balance, in my opinion, between the two, because I've seen women where their fibroids end up growing in menopause because of being on estrogen replacement. That estrogen replacement is really important for them, but we also don't want those fibroids to grow, right? So there's a little bit of a fine line there, and continuing to support, even if you don't use something as strong as DIM, fine. There are other ways to support your estrogen metabolism, which we won't go into today, but that it's important. That's another reason that's a good idea to do this test early on, because I will tell you, for the most part, if your estrogen metabolism is not good on the early end, it's pretty much going to be that way. Like, I've seen that with clients where multiple, it's just like, if they stop taking the supports that were helping to metabolize their estrogen better, then unfortunately that 16-OH or that 4-OH goes back up. So that's just kind of a little side. And then just really quick, this last page has a useful oat test, a small oat test, which is an organic acid test. And this is the best way to actually know what your true B12 levels are. Blood B12 is not the best way to know what's getting into the cells. This is really showing us what has gotten into the cells and has been used by the body. B6 is also a hugely important vitamin when it comes to hormones.
Yeah.
So that's on here too. And this is the best way to track that. Glutathione is hugely important, particularly for phase 2 liver detox. It's our master antioxidant. So this is also helpful to know. I don't work so much with the neurotransmitters personally. That's not my forte, but it is interesting to see where your neurotransmitters are.
Yeah, and then for sleep as well, you get the, the dopamine, the norepinephrine, melatonin. That can also be helpful with, women who struggle with that insomnia, although that's often linked to blood sugar imbalance or estrogen, lack of estrogen. But basically looking at, those kind of neurotransmitters that also help regulate your sleep cycles, or that can impact your sleep cycles, together with cortisol. It's also very helpful for sure.
Absolutely. So we'll come back to this test when we talk about the testosterone. Do you want to talk about saliva?
Yeah, so then there's also saliva-based tests, which is kind of the same as urine. You basically, in a sense, you get the free hormones, freely available hormones, not the ones that are bound to protein. And it's kind of, I mean, these tests are all like at home collection. So the one that we just looked at was where you would collect urine samples. And the saliva tests are the same thing. You can basically collect saliva samples throughout the day, or you can also do a cycling panel, and you can do the same with a Dutch test, actually, where you actually collect samples throughout your cycle. So you get a really nice map of your cycle to see where your hormones are at which stage, which allows you also often to see, did you, was your estrogen high enough? Did you make enough follicular stimulating hormone? Did you have enough luteinizing hormone? Did you ovulate? And how was then in the second phase of your cycle, your progesterone curve? So it's basically, for me, kind of the same thing, just missing the metabolites. You will not know about how you're metabolizing your estrogen, your testosterone. So basically, there were some questions linked to testosterone, and there again, it's sometimes important to see how are you metabolizing your testosterone, and also if you have a lot of inflammation going on. What we can see on the Dutch test is that some of your testosterone may actually get converted to estrogen. So that can kind of impact your symptoms as well.
Yeah.
So this is all stuff that you can't see on a saliva test, but it is as reliable in terms of seeing the free form of hormones.
Right.
And it's kind of the same, I guess, way to collect, just you're having to spit in a tube a couple of times per day.
Yeah. For some people that can be tough. I've gotten feedback.
Yes,
sometimes.
it's true. Yeah.
That's I'd say one of the cons is that for some people getting that enough saliva out, and not as big a deal, I think, when it's just a day test, but if you're doing the cycling test, that can be, you need to make sure you can freeze it. Not that big of a deal, but I will just put out, and some of this is controversial. This is not necessarily everything that I believe, but I will just put out some of the cons that I have heard about from different experts on these tests. And as I mentioned in the beginning, different experts like different tests. And for me, it's almost more important that the doctor, if you're working with a doctor on BHRT, that they just really understand the test that they're using, right? That they've been doing it for a long time, so that they have a huge sample of people that they're working with, so that they understand the best optimal levels according to the test they're on. But there is, I know that there is a certain hormone expert that they only utilize urine testing, which is a little different from dried urine. So the Dutch is the dried urine, where you basically, you pee either directly on this little piece of paper, or I always pee into the cup and then dip the paper in. And their argument is that the hormones, the lifting of the hormones off the paper isn't as accurate as total, urine. Like literally the test that they use, you have a big vat that you pee into all day for 24 hours. And that is more specific and more correct. That's an opinion of theirs. There are some experts that believe that the saliva, particularly if you're on bioidenticals and you're on, progesterone, that it can show very elevated in saliva testing, which may not be accurate as to what is actually going on in your body. The cortisol testing, I had was in some, class about, if you think about doing the saliva and you're struggling to get the saliva out, that can actually kick up your cortisol levels like right in that moment because you're feeling stressed, and so that can show up in the sample. Again, I think that there are going to be one more. Dry blood spot is the other one, which some people really like, but then other people say what you're getting from the capillaries is not a true indication of what your actual hormones are. So, as I said before,
I didn't know about this urine test that you just talked about, where you just basically pee in this big vat, as you said. But I mean, that would just take then an average of the hormones that you've been having all day, right?
Yeah. So, which is basically, I mean,
if you're like, if you look at the Dutch, I mean, no, it's also an average actually in the end, and not for the cortisol, but
Right. Exactly. So it's the same. And I think it goes back to like, are you working with a provider that really understands their testing method, right? I think that there's a lot of, I've seen this with clients where they're working with doctors, and this is great. They're open to hormones, but they're literally just like, tell me what to give you, they get a test and they're like, well, everything looks fine, so
don't we hear that a lot?
Right. And so it's not helpful, right? So if you are working with somebody that loves blood spot or loves saliva because they've been using that for 25 years, then I say you can trust them because they know, based on what they've seen.
And I think what's most important and what we also do is to actually relate that back to the symptoms, right?
Absolutely.
The test results are never just the gold standards. It's just basically looking at the test results and looking at the symptoms, and basically everything else we see from maybe blood testing or stool testing or basically everything we've done, and basically putting it all together. And absolutely, so that it makes sense, right? It's I also don't think there's probably not that perfect test.
There is definitely not.
Also depending on what's going on for you, if you're struggling a lot with insomnia, if you have sleep problems, if you're very stressed, then probably the Dutch test is worth an investment for you.
Right.
And if you just want to have like a rough idea of your hormones, you may actually just want to start with some blood testing to have a rough idea of what's going on.
I agree. I think that, every client that comes to me that has fibroids, we're running a Dutch. Everyone that comes to me that's having what I call any kind of growth situation. So that's fibrocystic breasts, that's polyps, all of those things. We want to see how that estrogen is metabolizing. That's the most important thing from that test. But we're also getting all that information around cortisol. We're also getting the oats test. And then, as I know that you do with your clients too, separate thyroid testing is so important too, because as we go deeper into perimenopause, we've already talked about how much stress impacts our adrenal function, and that is inevitably going to impact your thyroid too. And we start to see hypothyroidism really increase.
Yeah, it's called thyropause, actually.
Thyropause, I haven't heard that. Yeah. So don't miss out on that if your doctor is just trying to test your sex hormones. Like, you need to know what your thyroid is doing.
And not just the TSH.
Right.
All the thyroid hormones, at least the free T3 and T4.
Absolutely.
As a minimum.
100%. Those three that she just said, TSH, free T3, free T4. Don't let them just try and do free T4. That's a very small part of the equation. We'll talk a little bit more here about that in a minute. But also antibodies first time. If you haven't ever had your thyroid antibodies checked, go ahead and check those, because Hashimoto's is sneaky, autoimmune is sneaky. And a lot of times we have it for years before we know, because nobody's testing the thyroid antibodies, and it's a very cheap. Both of those are very cheap. What is it?
Yes.
TPO and TGB. Yeah. So those are key. Okay, so I know we're going on and on and on, and we won't have time to even get through these questions, but let's go on to the next thing. What are a few ways to get started on the journey of figuring out what hormones are doing and what to expect? E.g., finding a compatible doctor, may have to kiss a few frogs, recommended testing, knowing your numbers, types, etc. Yeah, so this is tough, because there are certainly a lot of frogs out there, I think, in the hormone world. I think you have to think, first of all, honestly, be really honest with yourself about how much you're ready to invest, because there are differences in terms of what you're going to get. Just because you invest a lot of money doesn't mean you're necessarily going to get a good doctor, but particularly up front, you're going to have to invest some money, and it's not going to be covered by insurance. And I know that sucks, but the reality is you're setting yourself up for the rest of your life. And getting in with a good doctor who is I think one of the big things to look for is, are they going to see you once a year, or are you going to be in touch with them, minimum every 3 months? Are they going to be, if you are getting onto bioidentical hormone replacement therapy, are they going to be testing you to see how your levels are and checking in about your symptoms? Because I've certainly seen some clients where they're just like, oh, they just put me on this thing and said, see you next year. That's not going to be when you get into hormone replacement therapy, that's not going to cut it, because I've never seen a woman that starts it and feels great off the bat. It's just not how it goes, right? You have to figure out for your individual body what is working and what isn't. So that's a big thing, I'd say, to ask a doctor if you get a recommendation from somebody, or you're just kind of, researching, like, how often are they going to be in touch with you? How open are they to questions, and you being sort of, them being in communication with you?
Yeah.
What are your thoughts?
Yeah, I'm not sure how to read this question, actually, if she's that was Michelle asking that, and she's basically saying how to get started on figuring out what your hormones are doing, what to expect. So I mean, that kind of made me think of, how do you know you're in perimenopause? So I'm not sure if that was what she was asking, but so yeah, she's asking about recommended testing, knowing your numbers. I think we can just agree on one thing, is that, from 35 years on, you will probably lack progesterone, and that might be very, very little and very subtle in the symptoms in the beginning, but it's there for sure. And basically doing everything you can do to support your progesterone, starting with stress management, but also making sure you get enough vitamin B6. You're maybe trying some Vitex, or trying seed cycling, basically, really adapting to listening. I think you really need to start also listening to your body, and kind of going with what your body naturally tells you. And then you can look out for some symptoms, like, your cycle might get irregular, or it might get shorter or longer. And you may actually notice that you're not ovulating by you will not have those fluid secretion around the mid of your cycle, or you may actually see some skin breakouts, or stuff that you didn't used to have, like on the nose or on the chin or something like that around ovulation, or when you go towards your period. You will maybe see more inflammation, you will see your mood change, you may actually be more irritable. The sleep is, I think, probably one of the first things that women also suffer from. So especially when you get to the end of your cycle, that you sleep worse, and it's not insomnia, but it's that type of tossing and turning sleep where
wired and tired
where you
situation.
don't really like get to rest. So you're just in bed, but you're not feel like you haven't actually slept much or didn't get enough like deep sleep.
Yeah.
Yeah, and then what was I gonna say exactly? Brain fog.
Brain fog comes in too, memory stuff. Yeah, I mean, I think that, you know, I think all of that's really important, and sort of everything that we've covered today is because I do think a lot of times what I see is women sort of, they're way sort of past the point where they should have started on these supports, you know? And so they're feeling horrendous and not like themselves at all. And even if you go on bioidentical hormone replacement therapy, and, you know, I mean, I don't know if you're 38, if this person asking this is 38, or if she's 47, you know? So there's going to be a difference in terms of if it's your time to go on hormones or not. Also, there's some people in their 30s that need to go on hormones because whatever reason, you know, their things have plummeted, they've had medical menopause, anything like that. But you know, I think starting to hone in on the lifestyle and dietary factors is what everybody needs to be doing, whether you decide to go on hormone replacement therapy or not. You know, I believe in hormone replacement therapy. I think, as we've said many times, you can't make your hormones keep producing. Like, when it's your time to stop producing them, and it's going to, for the majority of women, cause a lot of upheaval. So HRT is going to be very supportive in that process to not be as much upheaval. It's not to say that you're not going to have any, but you have to have these things in place too, right? Because case in point, I will see women go on progesterone and their anxiety increases tremendously, right? Progesterone is supposed to be our anti-anxiety hormone. It's supposed to make us feel calm. It's supposed to help us sleep, particularly the oral form. And I've even seen this in groups that I'm in where progesterone women will be like, I can't handle progesterone. It's like not working for me. And a lot of that has to do with your cortisol. You have to regulate your cortisol. Your body will produce more cortisol and sometimes take that progesterone and create cortisol out of it, because they go down the same pathway. So you have to understand, if you don't really hone in on the lifestyle changes, the stress reduction, that progesterone may go the other way for you. You know, I know in some instances, you know, injectable progesterone helps some women better than all other forms. So sometimes it certainly is a form, but I do believe that a lot of women are skipping over the lifestyle factors that they need to get in place, the diet, the stress.
Yeah, they're also more hard, aren't they?
What?
I mean, it's easier to just take a pill than, you know, managing like all the stress in your life, or
But just as when we have hormones in our 20s or 30s, if we don't, our bodies can handle more at that time of being sort of like, you know, off script. But still, if you're eating like crap and you're, you know, high stress and everything, it's still even going to catch up with you. I see it more and more with younger women now too. You know, we live a very chemical filled environment, like where our bodies are dealing with things that they have not ever dealt with before on top of all of that. And so you need to really focus on that as this is the long game approach, right? So I will say that I am working on creating a referral system for doctors that I have vetted, that are, you know, good in terms of particularly with BHRT and functional medicine, because I know how frustrating it can be, certainly, to spend a lot of money with, you know, multiple doctors and feel like you're not getting anywhere. But in the meantime, I guess what I said earlier, I think is really important. You know, do your research. Don't go with just the first person that you come across. We've talked about the testing. She asked about recommended testing. We've talked about that.
I mean, I think what we do as well, or I mean, here in Europe, I work a lot with clients who will go to their doctor for the prescription, but I basically, you know, we discuss the hormones and basically what needs to be done. And then they just take that to their doctor. And as long as the doctor is fine with, you mostly they don't know much about hormones, and they didn't, sometimes they will just go, yeah, tell me what to write down. Or some will just, completely be against it and say, no, hormones cause cancer.
Yeah, right. And hopefully everybody listening knows that that's not the truth at this point. But, I will say I have a hormone testing class, little course that people can check out if you want to know. In there, I actually talk about optimal numbers for different labs around hormones. So I go into
because that depends, right? If you're looking at blood serum or saliva or urine, the ranges are different.
Yeah, exactly. So I've got a handout, actually. I mean, I talk about them, and then I have a handout, an easy handout that you can print out. So I'd say I forget how much it is, like $22. It's a cheap way to, have on hand what the pros and cons are of the different hormone tests. So you can check that out. I'll put a link in the show notes. So I know that we've been on for a while. Maybe just we'll cover one of these testosterone ones and then save the rest for next time. Maybe we can combine them even. So this person said, I am very sensitive to testosterone. Cream makes my hair fall out, so I use injections. My blood levels will skyrocket, both total and free T very quickly. Then I feel horrible, very grim and uncomfortable in my skin. I limit myself to 7.5 milligrams weekly, injected sub-Q, to avoid this. I can do a little more if I go to the gym and resistance train on injection days. What causes the sensitivity and intolerance? And that's from Terrell, I'm not sure. And I'm just going to read the next one too, because I think we'll combine kind of the answers. Testosterone injections make me so hungry all the time. Is there a way to combat that without feeling like I just can't eat? Does it eventually go away? Been on injections for about 7 weeks. And that's from Melanie, And she said, I've been on T3 and don't notice any side effects, but just about 4 weeks into the T injections, it was like a light switch in my appetite, but I am not losing any weight. So that makes me worry.
Yeah. So basically both of these things made me think of the testosterone pathway. That we just saw on the Dutch test.
I'll bring it up again.
Maybe we can go back to that. So hair loss is basically one of the symptoms that you can have if you're not metabolizing your testosterone well. So you can see here your testosterone. Okay. I don't know if people can see when I point, actually.
No, I don't think so. Just
no,
me.
Okay, because I've been doing that before.
All good.
But yeah, basically you see your testosterone, and you can see that it basically has two different pathways, the 5-beta and the 5-alpha. And if you're basically metabolizing, like in this example, if you're overusing the 5-alpha pathway, which is the androgenic one, that will basically end up in symptoms like basically what also men have who have high testosterone. They have a lot of body hair, but not much hair on their head. So it's this kind of baldness, like in the middle of the head. But actually, it may have you may have excess facial hair. You may have acne.
A lot of times, hair loss for women will come more sort of on these sides too. I've seen that a lot for women.
Yeah. So that's basically what she says. She tells about her. She talks about her hair loss, and so she's getting those injections and will have like very high levels of testosterone, and it will probably ebb off. I could imagine as basically she gets later into when she was having, longer into when she was having her injection. So it may just be that your dose is too high, but also that you actually, and that may be genetically, that you need to support that pathway because you just have a predisposition to overusing your 5-alpha pathway. So the supplements that can help you basically prevent that. but yeah, it can also just be that you're just having too much testosterone, so
Right.
that you just need to adjust your dose, and you may do better with a different support of testosterone. And I think testosterone is actually a tricky one. Often women need it, but giving it as a bioidentical hormone is very tricky actually to get into like the right dose that you want to have.
Yep.
So DHEA is sometimes actually a better support that you can take. So you can see here also in this pathway that, you know, your DHEA will convert into testosterone. So you're basically taking a precursor to making more testosterone. And then things like, you know, just basically doing weight training and having sex, all these things will boost your testosterone levels. So all these are all things that you can do in terms of lifestyle, basically to boost your testosterone a little bit. And yeah.
Yeah. And I, you know, just going back to this test, you can really see that this person really favors this 5A. And it even says androgenic under here, right? And it doesn't say DHT. Actually, I guess down here it kind of talks about DHT. They actually used to have a DHT marker on here too. And DHT, I just always think of as that's very potent testosterone, you know, and it is going to show up in these ways with the hair loss, the hair growth on the face, on the nipples, sometimes even lower voices for certain women, you know, like anger, like if you feel really angry, like those are all signs. And obviously sort of the best way to know if that's your preference is to get a Dutch test and see. You can try, you know, there's certain supplements that are known, certain herbs that are known, particularly saw palmetto is kind of the most common one. I think both you and I have used the Prosta DHT, from Apex Energetics. That's got a combination. It's got zinc, which also helps. And a few other herbs that are helpful around that. I don't know how to say it, but there is a prescription called like spironolactone or something like that I know is used a lot from a pharmaceutical perspective to inhibit that pathway, going down that pathway, to inhibit going down that DHT. But, you know, I think it's best if you can kind of figure out maybe lowering the level of testosterone that you're getting and then utilizing some of these herbs to see if that helps so that you feel better and feel more normalized, right? It really, I mean, they're all Goldilocks hormones, but like testosterone, like you said, I think with using testosterone and this is why I'm against pellets. Like pellets, you're putting a huge amount of testosterone in your body at one time and way, way, way above biological level. And, you know, having crazy sort of reactions to a lot of women do. And then it about halfway through your pellet, you know, like 6 weeks or whatever, then you start to feel a little normal and then it starts to go away and you feel like crap again, you know? So it's just like, you need sort of to figure out a more sort of steady dose of what works for you. And I imagine with injections, you know, that's a pretty intense dose that you're getting right off the bat too. So it may be about sort of lowering that. And then I know we want to talk a little bit too about the question about the weight issue around it. You know, one of the things that you can see here with testosterone is that it is a precursor actually to estrogen. And you can see here it says aromatase on here, right? And so basically in some of us, we convert more of that testosterone to estrogen than maybe we would like or need. And
you see this in men, right? The typical beer belly and breasts that come from all those male foods, like you know, beer and pizza and it's everything that spikes your insulin,
right?
Causes aromatase, and same happens in women too.
Right, absolutely. I'm glad you brought that up. It's like inflammation, you spiking blood sugar. This is all going to impact that, which is why, again, goes back to diet, how important it is to really get more protein than you would think that you need in perimenopause, right? The older you get, it's almost like the more protein that you need. And that's going to help with inhibiting that aromatase. There's also aromatase inhibitors that you can take, you know, supplement wise. I believe that there's also prescription one too, but I think the herbs are pretty useful in that sense. And so that could essentially, be happening in that situation with a weight loss stalled, because we know that sort of that excessive estrogen can lead to weight gain, right? Or trouble with weight
and also
loss.
to cravings, right?
Right. Yep, absolutely.
Yeah.
So let me make sure I didn't miss anything else on there. So that might be part of what's making you hungry, is there is, that conversion happening to estrogen. It's hard to say without seeing a test, of course. That's just a guess on our part. In terms of the T3, I could see T3 increasing your appetite because your metabolism is actually starting to work better. You probably didn't have enough T3, which is our active thyroid hormone, for those that don't know. If you didn't have enough T3 going on, then there's lots of things that happen from that, hypothyroid issues, and certainly a suppression in appetite can be part of that. So maybe your appetite kicked in because you were actually getting enough T3, but that coinciding with maybe too much testosterone, just like your appetite was like, wow, because of that sort of conversion to estrogen. So that would be sort of my guess on maybe the connection there, even though it doesn't sound like you're gaining weight, you're just not losing weight at this point.
Yeah, and it may also be just diet, in the sense that you said, right, that you may not be eating, your meal may not be balanced enough, so you may actually not having enough protein or not having enough fat often I mean, many women are just skimping on these nutrients, especially the fat, because it's also equal calories.
So I always say, if you're, getting hungry under 4 hours, then you probably did not get enough fat in your last meal. For me, it's protein too. But, if you're getting hungry 2-3 hours after you eat, then that's a really good indication that you just didn't get enough fat and probably protein in that last meal.
Yeah, I mean, that's just one really basic thing that could also be happening there, that just the meals are also not balanced enough. So and then if she's working out, and then, basically all that in combination, as well, as you said, with high testosterone and actually the metabolism kind of kicking in, that can definitely be a thing as well.
Right. And I just want to add, so that people understand, like, not just why high T or high testosterone isn't good on the androgenic side of things, but if you know of PCOS, which is polycystic ovarian syndrome, the two main issues with that is high testosterone and blood sugar imbalance. And weight gain is a huge part of PCOS. I'm not trying to say that this person has PCOS at all. I don't think that, that she does, but we just have to understand that high testosterone, like, no good comes out of our hormones being too high, just like too low, and we have to figure that out, honestly, individually. And that's why I go back to, you need to work with somebody, a practitioner like one of us, or a doctor. And I like to work alongside doctors, is, to understand that we have to follow the symptoms of your own body. And so that's going to mean trying different levels of hormones, until
it's so bio-individual, isn't it? I mean, I
really
think
is.
I've just said this like a couple of weeks ago, like, there's, for hormones, there's really no one size fits all. Everyone is so different. So, diet or supplements that work for your friend may not work for you at all. And you just need to try them as well to see what does work for you, and really, just as you said, listening to your body and kind of knowing, like, honing in and being able to interpret these symptoms is really just a big part of it, I think.
And I wonder, with this particular person, Melanie, if you tried other forms of testosterone first, or if you just went to the injections. My guess is that's probably not the first thing that you tried, because most people try topical, first. But it could be that topical or another form is better for you. You just needed maybe more in the topical form. I know it's not always absorbed super well for everyone, but sometimes it's just too low. So I would say, if you don't feel like you can level out on injections, thinking about a different form.
Yeah.
So Okay, you guys, we just covered so much. I know. And there are a ton of questions, as I mentioned, that we don't have time to go into today. But we did want to let you know that we are going to be running a fantastic perimenopause program starting on July 10th. So basically, we are going to cover everything that you need to know to go into your perimenopausal years or work within your perimenopausal years. If you're already there, we're going to be talking more about diet and lifestyle. We're going to be talking about symptomology, what to look for, what different symptoms mean in terms of what's going on with your hormones. We're going to cover all sort of the intricacies of herbs and other supplemental supports that can be helpful. Marieke is including her amazing cookbook, which is going to be one of our clients actually told me that is like her favorite cookbook that she's ever gotten, and she's a very picky person. So I loved hearing that. That's going to get you off on a good foot, whether you're 35 just starting into this, or whether you're 50 and you've been dealing with all of these things, because as we've talked about today, it's everything, right? It's the whole package together. It's a holistic approach that we have to take to perimenopause, but also we don't have to go through hell for 10 years too, and I think that's what so many women are experiencing, because we're not educated on this stuff, and we don't know the ways that we can be empowered to take care of ourselves. So we're going to cover all of this in 4 weeks. It's going to be kind of a dual program where you get a video and written packet on Monday of each of the weeks starting July 10th. And then we're going to do a live Q&A every Friday at 12 p.m. Eastern Standard Time. So basically, kind of like today, you can just come on with your questions and we will answer whatever comes up. We'll also have a group page through where you purchase the program. So it's going to be a private group that you can ask questions there, and we can, really keep you up to date on everything that's going on there. It's going to be really fun. I'm excited
Yeah, I think
to.
so.
I love sharing this information. I love
Yeah.
empowering women, and I know that you do too. So yeah, we're going to have that. Like I said, starts July 10th. There is going to be a link in the show notes from today where you can go ahead and purchase it. I think we do have limited spacing, so I would recommend going ahead and purchasing it right away. And got a discount code in the notes too, and that's only going to last for 3 days. So go ahead, sign up, grab your spot. Do know if you can't make the lives, we're recording those, so you can listen to those later. You can send in your questions beforehand if you can't make the lives. There's gonna be a lot of opportunity for you to ask questions, so it's gonna be good. You have anything to add?
No, I think that's yeah, it's pretty good, and I think it's just really your basics to perimenopause, right? Kind of some of the questions that we got, like how now I have this and I don't know what to do with it, and so we're really going to cover like all the symptoms that you may experience and why that is and what you can do about them. So really just debunking a little bit, what's going on in perimenopause, because I see so many women just struggling and having so many questions, not knowing what's going on, thinking they're going crazy.
Yep.
And yeah, no, you don't have to go crazy. And we just really want to spend that time together with you and guide you on that during this program, so you can, in a nice small group setting, really, discover these things and exchange and ask your questions, and transition also, diet wise, and make those changes, try supplements that will work for you. And basically, yeah, I think it's pretty good to do this in 4 weeks. It's pretty feasible, right? And it will really just give you the basics of the perimenopause journey.
Yep, we're giving you the foundation, so come
Yeah.
join us. Marieke, thank you so much for being here and answering these questions with me
Yeah, it was fun.
today. It's so fun. So I think I've said in the past, feel free to send questions that I will include in my little document, that we'll do more of these Q&A sessions if people are interested in it, because I think we can cover lots of different things doing this. So feel free to send those questions along too. But check out the notes. Go ahead and join us for all of July. in our perimenopause program is going to be super awesome. And
yeah, we'd love to see you there.
Yeah. And we'll be taking a break on the podcast for the next 6 to 8 weeks. But definitely still tune in, because I'll be bringing back some old episodes that you might have missed before that have got great information. So stay tuned for those. And I will see you soon. Bye.
Bye, everyone.